I'm Dr. Ganesh. IBD is inflammatory bowel disease. Today happens to be an IBD day. There's another common term called IBS. People tend to confuse. IBS is irritable bowel syndrome, which is not a disease really, but it's a lifestyle kind of disorder. Whereas IBD, inflammatory bowel disease, is a disease. It has two components. One is ulcerative colitis and Crohn's disease, and both of them are more in the Western world. And as the environment changes happen, as India is developing, we find this disease on the increase these days. So the colitis, the main symptoms are loose stools, bleeding in the rectum with abdominal pain. These three combinations can be there. And large bowel involvement predominantly is colitis. Crohn's involves also the small bowel. So it's important for somebody who has diarrhea for more than a week with bleeding to consult a doctor and make sure. A simple sigmoidoscopy, we should be able to see the ulcers and maybe take biopsy to arrive at a diagnosis. Because this happens to be a long-term disease which needs regular medications to maintain the disease. Anybody who has diarrhea for longer than say 2 weeks with bleeding, especially with abdominal pain, needs an investigation. Normally we do a complete blood count first, and then a small sigmoidoscopy which will examine the lower rectum and take biopsies from the inflamed region. The incidence of cancer of the rectum is also higher on patients long-term ulcerative colitis. So it's important to be under surveillance with the doctor. And this disease has two words. One is called relapse and remission, because this is a kind of an autoimmune disease which can be controlled but not cured. So people tend to be in good remission. Suddenly there will be a flare up of the disease, which we call relapse of the disease. So it's important to be under follow-up and make sure you're on regular medications, which will, and there are a lot of newer advances in the management, but then it happens to be a long-term disease.